Welcome to our Benefits Officers Network meeting. My name is Candace Butler. I'm a Human Resource Specialist here at OPM in the Benefits Officers Training and Development. Our manager, Shania Hill, couldn't be here, so I'm pinch hitting for her today, okay? We wanted to just talk about a few things that's taking place here at OPM. For this webcast, for this network meeting, it is also going to be recorded, and this is for the benefit of individuals that couldn't be here personally, as well as for our HR specialists on the West Coast. We know this is kind of early for them, so at least they'll be able to get this information at a later time. We wanted to let you know that many of our webcasts, or just about all of our webcasts, are recorded, and they are on our website. So if you're not familiar where to find them at, if you go to opm.gov, then if you go to the link that says Agency Benefits Officers, then from there if you go to Benefits Information, then if you go to the Benefits Officers Center, the second tab says Webcast, and so the webcasts that we've done actually go back to 2012. So it's a good resource to have. The webcasts are there. Many of the slide presentations are there as well, so that you'll be able to get the information that we provide. We also are planning on doing a few more webcasts before the year is out. We always do one for the open season. So the Health Benefits Open Season 1 will be taking place soon. FDIC Money Smart, they have a new program that they're going to be rolling out. We actually had hoped that that is what this webcast was going to be, but they're not quite ready yet. So a little bit later this year, that will be rolled out, and so we'll be sending out information about that particular webcast. As stated in our August 23rd Save the Date, we are working hard on getting the Fall Festival together. I actually went out last week to do a site visit, so hopefully the contract will be signed this week, and then the announcement will come out. I can't say exactly where it is, but it definitely will be on the West Coast, and it will take place from November 27th through the 29th. And we know we get a lot of questions about why are we having it right after the Thanksgiving holiday. We have to do it, we try to do it right after, the fiscal year. We can't do it before the fiscal year, so we have to do it right after the fiscal year. And a lot of times the hotels don't have the beginning of November available, and so that's why we go to the end of November. So we apologize in advance, but because we are trying to do 2 training events a year, that's the reason for the November 27th through the 29th date. So an announcement will be coming out shortly with the full day and half day workshops that we will be offering. We also, as you know, do FERCA training. FERCA is for those individuals who have been found to be in the wrong retirement system. Unfortunately, that is still taking place today. You would think by 2018 we wouldn't have people in the wrong retirement system, but unfortunately, I just had a case yesterday, so FERCA is still being found. So our next FERCA training is going to be on October 16th and 17th. It's going to be hosted by the Bureau of Land Management in Denver, Colorado. So again, October 16th and 17th in Denver, Colorado at the Land Management Denver Federal Center. An announcement about that FERCA training will come out probably next week. We didn't want to send it out this week and have all these different emails flooding your email, so that's why we're trying to span when we send information out. But I thought I'd give advance notice for any who are interested in FERCA training. And of course, we'll be doing more here in the DC area as well. We also will begin working on our spring training event. We know that this year it was in May, and that didn't go over too well with many of you because May is a lot of times for graduations and things of that sort. So we will be moving back to looking at June. We're looking more like southeast area, so maybe somewhere like Florida or North Carolina. But additional information will come out about the benefits training. In our office, Benefits Officers Training and Development, I don't know if you know, but we're down staff, and so it is definitely impacting assisting you benefits officers. We realize that we have Our top manager, Karen McManus, is actually on a detail to retirement policy, as well as one of our human resource specialists, Jonathan Kogut, is on a detail. So that's down 2 specialists to assist you. Then many of you know Phil Gardner retired last month. So we do have, we just had a position that closed about a couple weeks ago. So we will be hiring 2 from that position. And then hopefully Phil's position will be coming announced shortly. So we're trying to get back up to staff with that. So in the meantime, Shania will be working on designating the agencies to the 4 of us that are left. So if you're a headquarters level specialist, you will be getting an email from who your new representative is, who you should send your questions to. We just encourage that you have your field office people make sure that they come to you. And then if you can assist them, then you, as a headquarters level specialist, come to us. Because as I said, there's only 4 of us, and we're trying to do the best that we can. And so we're just trying to keep our heads above water with that. So before I turn things over to Mike Evans to talk about some benefits administration letters that are going to be coming out, are there any questions? And if so, we have 2 in the mic that will be handling, that will be providing the microphones. We want to make sure that all of the questions are done over the microphone so that those on the, those that are watching in for the webcast can hear the questions from everyone. So are there any questions based on anything that I've stated? If not, Mike, you want to come over?
Welcome, everybody, and I'm glad everybody who's here made it through the rain and everything else, and I hope everybody's all prepared for Florence. Depending on how that's going to play out, I guess we just have to kind of wait and see, right? So that being said, as Candace mentioned, we do have a couple benefits administration letters coming out. One of them deals with an issue that has gone on for a while, and we seem to have recently gotten a lot of questions, and there's been some misinformation put out there. It deals with the use of unused sick leave. Specifically, the use of unused sick leave as far as under FERS for someone who is at least age 62, and the sick leave gives them the 20 years, and whether or not that would qualify them for the 1.1% formula in the FERS benefit. The answer to that simply is yes. If you have, as you know, sick leave can't be used to establish eligibility to retire, right? So eligibility is codified in one section of Title V. Computation is codified in another section of Title V. And the eligibility requirements at age 62 are to have at least 5 years of creditable civilian service. That's the eligibility to retire. As far as whether you get the 1% formula or the 1.1% formula, that's dealt with in the part of Title V that deals with computation. So it's not like you're attaining eligibility for something else, like another type of retirement. It's still a voluntary retirement, it's just the formula that we use. And that seems to be where the confusion is. So let's say you have somebody who is 62 and has 19 years of service, but they have a year and a half of unused sick leave. When they retire, that sick leave is going to get added to their length of service. They were already eligible to retire, so now this 1 year of sick leave is going to give them, or 1.5 years of sick leave is going to give them the more than 20 years, so that will qualify them for the 1.1% formula. The BAL is going to give you the exact citations from Title V and the CFR that deal with this, but just so you know, that'll eliminate any confusion. If you get any questions about it, you'll have the citations right there in the BAL. The other BAL that is coming out deals with military retired pay. And again, it's more, this has been an old issue, but we're actually clarifying it now, and it has to deal with people who have service that is not included in military retired pay, military service that's not been used in the military retired pay, and whether or not they can get credit for that without waiving their military retired pay. Essentially, prior to January 1st, 2007, if people had military retired pay and they had service that was not included in the military retired pay, they could use that, pay a deposit for it, and get credit for it in their civilian benefit, even though they were receiving military retired pay, because that military service wasn't used in the computation of the military retired pay, they could get credit for it. There was also some confusion about which period of military service they would use. And people could pick and choose, or thought they could pick and choose, and would a lot of times choose like the service at the beginning of their career because they would owe less of a deposit potentially than later on. Now what we're saying, we're looking at the law and the regs, and essentially what's going to happen for service prior to January 1st, 2007, if there is military service that wasn't used in the computation of military retired pay, we are going to need from the Military Retired Pay Center, or from the branch of service where that was performed, the specific time period of the period of service that was not used in the military retired pay computation for us to use it, so we can actually get the earnings for that period. So there's no picking and choosing. It's actually what periods of service were used in the computation and what periods of service weren't. Now, on or after January 1st, 2007, things changed. Basically, the 30-year cap on military retired pay was abolished. So going forward, January 1st, 2007 and later, there is no military service that's not used in the military retired pay because they abolished that 30-year cap. So that goes away now, okay? The only exceptions are officer candidate school and academy time, which were never used in the computation of military retired pay in the first place. So if you have officer candidate school service or academy time, people can still get credit for that even though they're receiving military retired pay, because that was never included in military retired pay. Okay, so those are the two BALs that are coming out, and they'll give you a lot more information than what I just did, but that's a brief synopsis of it. So at this point, I am done, and I believe I'm turning it over to Maggie now. Okay, great.
Okay, hi everyone. My name is Marguerite Martel, and I'm a senior policy analyst here at OPM in healthcare and insurance. And I'm going to talk to you today about a new benefits administration letter that was released recently about the Federal Employees Health Benefits Program. So, in January, we published a final regulation, and it updated the rules for removals of individuals from existing FEHB enrollments. So, just generally, a brief overview of the regulation. There's the regulation provided that OPM will provide guidance on when proof of eligibility will be required to cover family members. The regulation also allowed removal of eligible family members from existing enrollments. And the regulation provided a process for removals of ineligible family members from enrollments. So the part I'm going to talk to you about today is number 2. So just a brief overview. I'm sure most of you know this, but our statute actually tells us who is eligible under an FEHB, Self and Family, or Self Plus One enrollment. And by law, that is a spouse, and that includes same-sex spouses now, children up to age 26, and children, there's natural children, stepchildren, adopted children, and foster children can all be covered under your FEHB regulation. And for more, under your FEHB enrollment. And for more information on that, you can look at our handbook, which is available on our website. You can also cover a child incapable of self-support due to a condition that existed before age 26 when they're older than age 26. So if somebody has a disability or some condition that happened to them before they turn 26, they can continue coverage under the FEHB enrollment. Okay, so we published a benefits administration letter on August 21st, 2018 that talked about removing eligible family members from FEHB Self+1 and self and family enrollments. And the BAL has attachments that provide standard language you can use with your enrollees, so and your employees, so I recommend checking it out. We're going to publish separate guidance on requesting proof of family member eligibility and removal of ineligible family members. Those were the other two parts of the regulation. And I can give a brief explanation here so you guys know what I'm talking about. When we went to age 26, we got a lot more requests from you guys, agency people, saying that an enrollee didn't want to cover their children anymore, right? Because the child was older, it was up to age 26, they might have their own coverage, they might be, having a fight with their child, there was more time for that fight to occur. We got rid of dependency and residency requirements. So we, just from the volume of requests that we got, we took a look at our policy, which was you couldn't remove an eligible family member from a self and family or Self+1 enrollment. And, we published a regulation and we determined that in certain situations, it makes sense that an enrollee may want to or may be able to remove a family member. So that's the impetus of this, this guidance and this regulation in this BAL. So it was funny because this was when the benefits administration letter came out, there was an article about it in the Federal Times, and my coworker, Jay, who's sitting in the back right here, he sent it to me and he said, the comment is wrong about what this, is confused about what this BAL is about. And I think it's easy to have confusion about what we're talking about when we're talking about a removal. So the comment in the Federal Times said, well, they've always been allowing that because I was allowed to change to self-only when I didn't want to cover my child anymore. And that is not what we're talking about here. So these next couple slides are trying to explain what we're talking about. A removal is when you maintain the same enrollment type, like self-only, Self+1, self and family, but you just want to remove the family member from your existing coverage. You're not changing enrollment type. And that would mean there's no premium difference, right? Because you're still enrolled in self and family. And you don't need, or Self+1 or whatever it is. An enrollee does not need a QLE to do that because they're not changing enrollment type. This second bullet is kind of about our talking point on removals. In the majority of cases, a family member with other health insurance who is also covered under FEHB can maintain both coverage and does not need to be removed from an FEHB enrollment. So in other words, a removal should hopefully be kind of a rare thing for people, right? It should only be when, for some specialized reason, somebody wants to keep a self and family or a Self+1 enrollment, but doesn't want to cover just one family member or two family members or something like that. So hopefully that makes sense. The next slide talks about the contrast, which is decreasing enrollment type, right? And that's what the guy was talking about when he commented on the Federal Times article. If an enrollee participating in premium conversion experiences a qualifying life event and would still be able to cover all desired family members, generally the enrollee should decrease his or her enrollment type. So if I have a Self+1 and my husband passes away or we get divorced and I can go to self-only, that's decreasing my enrollment type. Like I wouldn't do a removal in a case like that. And once again, removals should only be used in limited circumstances. Okay. Mm-hmm. Yes.
We're just talking about a self and family only, right? not self plus one, because if you do a removal, you're going to be changing enrollment, not a removal.
Yes, that question makes me very happy because it's clear that you understand exactly what I'm saying. And I had discussions with people in the agency about this. We wanted to allow a removal for self plus one if there was some reason we couldn't think of that an individual would want to do that. Like, I keep wanting to pay self plus one premiums even though I'm the only person on the enrollment, right? But you're right, it doesn't make sense to do that in most cases. It would be, the prime example that I can think of is, I have self and family. I cover my five people, right? Me, my husband, and my 3 kids. My oldest kid ages out and now doesn't want to be on my enrollment anymore. So I would do a removal in that case because I still have 4 people to cover, so I want to keep self and family. That would cover all the 4 remaining. So your question makes perfect sense, and I hope that answer made sense.
Yes, but I have another question.
Okay, good.
So with your 5 family members on yourself and family, and you said your child age out,
Yeah.
isn't the insurance company going to automatically remove them? You don't have to do a removal? Because they're not going to pay anything. If
You're right, I should not have said that. My child gets a job is what I should have said. So my child is 23 or 24 and gets a job. You're right. Thank you for your questions, that helps. Okay. Yes, go ahead.
Wait for the microphone, please.
Oh, sorry, wait for the mic so everybody can hear you.
Well, I can make sure they hear me. But thank you. My thought goes to the people are people, and am I correct in assuming that if a person is okay, I am extremely perturbed with my 21-year-old child, and I want them off, et cetera, and they go through the process of removing them. Is that person off forever, or would they be able to reinstate that person at the next open season?
Yeah, I'm gonna get to that soon, but it is not a forever situation, and that's a good question. People change their minds. Okay, so, and I'll get to that more later on in the presentation. Okay, so because this is kind of a delicate situation, as you mentioned, there could be reasons that are not in the best interest of the government for people to remove people. For enrollees to remove family members. We designated certain situations where removal is allowed. And there are 3 of those situations. So the first is for a spouse. And a spouse may be removed if both the enrollee and the spouse provide a notarized request for removal to the enrollee's agency. And that is because sometimes there are divorces or people fight, people get separated, and someone could have an interest of wanting to remove a spouse just because they were angry at them or to spite them when they're actually still eligible for coverage. So we require that both parties in this case say, yep, that's really what I want. I want to be removed. So that's the first situation. The second situation is an adult child. A child who has reached the age of majority can be removed in one of 2 situations. So the first is if the enrollee provides proof that the child is no longer his or her dependent. The child can be removed without the child's consent. So, yeah.
Question on the spousal.
Yeah. Oh, can we wait for the mic? Because I think it's for the webcast part, right? Yeah. Mm-hmm.
So a question on the spouse.
Yep.
Say my husband and I have self plus one.
Mm-hmm.
Now my husband gets a job that has really good health insurance. So I want to save myself some money and go to self only.
Mm-hmm.
So here is an opportunity to remove him. So that would have to be notarized, correct? And I do not have to wait during an open season to drop him.
No, you're doing a perfect example of when you would want to actually decrease your enrollment type. So you would experience a QLE that the only other existing family member on your health insurance coverage gained other coverage. So you should go to self only because this wouldn't save you any premium. You would still be paying the self plus one premium if you did a removal.
That doesn't make sense.
I know it's a little confusing. Let's keep pushing forward, and hopefully with
Now,
more
I need to
examples, it'll make
understand
more
this
sense.
because we've got folks that are potentially facing this. So if I've got, so you're saying in my situation, I would still have to pay because, say if it wasn't, if I wanted to
No,
drop
all I'm
him-
saying is you should, if an employee came to you in that case, you should counsel them to decrease coverage type, to go to self-only, not to do a removal.
Okay, so, and that would be considered a life event because he got.
Exactly, because he gained other coverage, yes. Okay. So we were talking about adult children who reach the age of majority. So an enrollee can remove an adult child by providing proof that they're no longer a dependent. And in that case, we've asked that when that happens, the enrollee provide the last contact information for the child so that the child can be contacted, the last known contact information for the child, so the child can be contacted that they're going to be removed from coverage. I mean, you know, you guys know because you work in HR. When you work in HR, you just, the craziest stories come up of reasons why people need to do, you know, removals. And it definitely happens that sometimes people have children who have gotten into bad situations and now they're sort of dragging a parent down and there are issues. And so we are allowing people to effectuate these removals because we've definitely seen situations over the years where people needed this ability to do this. So the child requests to be removed and provides a notarized request for removal. This is the other way around. If the child doesn't want their parent involved in their health insurance, maybe they don't want them to have access to the kind of claims they're getting or whatever the situation may be. If you hear from a child who wants to be removed and they provide you a notarized request, you can remove the child at that point. We have one more question.
I have another question. So the child can now call here, give me their parent's CSA number. I'm going to go in their account without the parent's permission and make a change?
Well,
But I'm still not going into the child's account. I'm going into the retiree's account without the retiree's permission.
yes, because you're talking about only adult children who are able to make their own decisions about health insurance at that point, and it would be no cost change for the enrollee. It would just be that, you know, my 24-year-old doesn't want to be covered under my health insurance anymore.
Some of the retirees that we have, so that means if they send me that and I call, let's say Blue Cross Blue Shield, they're going to send a letter to the retiree. The retiree will call back.
Oh yeah, we
"You
have to
gave you
notify, we have to notify the retiree, that's right.
So that's just like now, if a wife calls and she's not the retiree, I need to talk to the retiree to get oral authorization that I'm allowed to talk to her about his account. So I don't need oral authorization from the retiree that the child says, go in my parent's account and take me off or remove me.
No, not in this situation, but I can talk to you offline more about OPM retirement procedures, and we can talk about how we're gonna implement it if it's different than what's done today.
Okay.
But you know, it's an individual who's an adult and has authority over how they want their health insurance, you know, to be administered. So I would imagine that this would be pretty rare, but once again, working in HR, you just never know what surprises that you get. So.
So say you have an employee that is in self-plus-one, and you receive the notarized statement from the child that is of age. Is that going to be considered a QLE or just a removal, because then it just leaves the employee?
Yeah, this is addressed in the BAL also. It's not considered a QLE because the problem is, if you did that, people could just effectuate a removal and then make a QLE happen, basically. So the person would just need to wait till open season or to a QLE happened in order to decrease enrollment type. Okay, good questions. Okay, oops. Okay, so I wanted to talk a little bit about age of majority. This is also addressed in the benefits administration letter. And this is talking about when you know somebody is of age. We're following state law on that because it's our best option in terms of what's going to be applicable. So the age of majority is the age at which the child legally becomes an adult, and it's governed by state law. In most states, the age is 18. However, some states allow minors to be emancipated through a court action. We are not going to maintain a list of all the state laws on this, but as I said, in most cases, it's 18. And I think we provided a link in the BAL, which was a legal source that provides all of those laws. And so it's usually going to be 18 for children. The only difference would be sometimes if somebody had maintained a court order of emancipation, a child had maintained a court order of emancipation, then that may be a younger age at that point. Okay, so the BAL gives really specific instruction on how to effectuate a removal, and this is kind of a summary. Agencies will be using an information-only SF 2809 to communicate the removal to the carrier. And we already mentioned that in a spouse's case, both the enrollee and the spouse sign a notarized request. If it's a child request, the child must provide a notarized request. And if it's an enrollee request, the enrollee must show proof that the child is no longer a dependent, and the enrollee must provide the last known contact information for the child. And the BAL actually addresses which portions of the SF 2809 need to be filled out. Because of the nature of removals, you wouldn't have the information to fill out all spaces of the 2809. So the BAL goes over exactly which parts need to be filled out. Okay. And now I have a few examples. And so I'll read the example, and I'll see if everybody can tell me what you guys think, if this came to you, what you would do. So an enrollee covers his wife and his adult daughter on a self and family enrollment. His daughter gets a job and becomes eligible for other coverage through her work and no longer needs FEHB coverage under her father's enrollment. Her father does not want to pay for a self and family enrollment now that his daughter no longer needs FEHB coverage. Should the father remove the daughter from the enrollment? Yay. Very good. So what should they do? Oh, the answer was for the webcast people. In this case, no, they should not effectuate a removal. And he should reduce coverage from self and family to self plus one under QLE code 1P. Okay, so now the father covers his wife, his daughter, and his son under an FEHB self and family enrollment. His daughter's employer-sponsored coverage is in the form of a high-deductible health plan with a health savings account with contributions from her employer. For her to receive coverage under her employer's plan, per IRS rules, she can't also be covered under her father's FEHB plan. Should the father remove his daughter? And yes, in this case, this is the classic where a removal would be appropriate. You have extra family members you still want to cover, but for a legal reason, your daughter doesn't want to maintain the coverage to get her employer-sponsored coverage. Okay. And this goes to Joe's point. If an eligible family member is removed, he or she may regain coverage under the applicable self plus one or self and family enrollment if requested by the enrollee during open season, or within 60 days of the removed family member losing other health insurance coverage if the enrollee provides written consent to reinstatement of coverage, proof of eligibility of the spouse or child as a family member, such as a marriage license or birth certificate, and proof of loss of other health insurance coverage. And our goal here was to discourage a lot of removals, like in the, you don't want people to be removing and then putting back on and removing and putting back on all in the same year. It should be a decision that's based on a real reason. But also, if people do lose coverage or the reason that they wanted to be removed in the first place, then they should be able to be added back onto the coverage. So, I think that's all in terms of the eligible family member removals.
Okay, before you go
yeah.
on, we have a few questions online.
Okay.
One of them, since we have letters HR is supposed to mail the removed family member, if we have no way to contact the age of majority child, parents don't know where they are, that is being removed, can they still be removed?
So I think that the answer to that question is yes. I think that, however, this is the issue where if the last known address is like your address, you know what I mean? Like, so you wouldn't have anywhere. I think we want as much as possible, obviously, to notify children. So if there's any possible way that they should be notified. But a removal is still allowed, even if the parent truly can't provide the last known address.
Okay. Second question, and there's about 10 of them here, so I'm going to.
I feel so popular.
I know, right? So
It never happens.
We have an employee whose daughter is turning 26. She got married in 2017, but never added her husband to her plan, as he had his own plan. But she maintained her family plan for just her and her daughter, as the cost was really no difference with self and family to self plus one. She now wants to move to self-only plan when her daughter turns 26. Will she be able to do that with being married, since she wasn't on a self plus one plan?
Yeah.
Yeah.
Mhm. It's a QLE, and she can make whatever enrollment changes that she wants in that sense. You don't have to move just one enrollment. You can make an enrollment change based on the QLE of her daughter aging out.
Okay, This one has 3 different scenarios here. Employee is enrolled in Self Plus One plan with their spouse listed as the eligible family member. Their spouse is also enrolled in health insurance through their workplace and has been covered under this insurance for 5 years. In March, the employee and spouse request to have her removed from his insurance. The spouse didn't gain coverage within 60 days to utilize QLE 1P, changing to a self-only plan, so a request to remove the spouse would be submitted, but the employee would remain in self plus one plan with no eligible family member listed. Are the carriers aware this may happen?
I don't know if the carriers are aware. I mean, the way insurance works normally is that, it's not tailored to your exact situation. You build up a reserve, and then, sometimes good things happen, but bad things happen. You're trying to insure against risk. So I think that they're always prepared for there to be some risk involved of something that wasn't expected, and they try to use actuarial calculations to come up with that, if that makes sense.
It was a long one. I actually there are a couple others that are just about as long, so I'm gonna kind of let you guys deal with those.
Good, because I'm starting to get nervous now.
Yeah. Okay. This one is very short. Can you provide examples of removing family members off of a self plus one enrollment?
Yeah, I mean, the only one I can think of, and this is the best removal situation I've heard of, is say you were covering just your child, and your child had employer-sponsored health insurance, so they were already eligible for it, but it got better, or they moved away and they want it now for a new situation, or I think moving away is a QLE though. They didn't move away. They gained for some reason they decided they wanted to enroll in their employer's plan, but they didn't just become eligible for it. And they can't, it's an HSA plan, so they can't take advantage of it unless they are removed. Like, you can't have other health insurance coverage if you're gonna get money into your health savings account under IRS rules. So maybe some situation like that, but honestly, in most cases, I cannot think of a reason under Self Plus One this would be something you would want to do. I honestly can't think of it. Or if you're really mad at your child and something really bad happens, maybe where you are going to go into bankruptcy because of their health insurance costs or something of that nature, and you have no QLE to make a change, and you are only covering a child. That's the only thing I can think of.
Okay. And I'm going to defer a lot of these. I know we're short on time, but I'm going to bounce this one to you. Previously, employees separated from their spouse couldn't drop them until the divorce was final, as that was when the QLE took effect. Does this new rule change that? Does it allow employees separated from their spouse the opportunity to remove them? Also, can you explain how the time frame was selected for the removal to be effective?
Yes. So it would only be allowed if both spouses agreed on it in a separation case, so it couldn't be unilateral. So that's our attempt to deal with the issue that you're talking about, which is, sometimes people were angry at people about divorce and just wanted to take them off their health insurance. So in this case, at least both spouses would have to sign and agree, so hopefully it would mitigate that it was just over a fight or something like that. But I guess the answer to our question, strictly speaking, is yes, as long as both spouses agreed.
Okay.
Yeah. Oh, sorry, wait. I think there was a second part that I was.
Also about the time frames.
Oh yeah. Let me speak to this real quick. So when we did the proposed regulation in the Federal Register, we received comments from some of our insurance carriers, and they actually requested that we delay the effective date so that they could ensure that they could effectuate the removal and not be erroneously paying claims. So that's why if you see the effective date, it's the second or third pay period after the removal is effectuated, and that's the reason. It was based on public comment on our regulation. So I just wanted to highlight that. Did you have another question?
I'm stuck on the spouse thing.
Yeah.
You can go to self-only at any time.
You can go from self-only to self plus one? No. I mean not in premium conversion.
Annuitants.
Oh, yes, that's because you work in retirement. Not in premium conversion. Premium conversion is pre-tax premiums that are only available to employees. So in a lot of cases, they can't reduce enrollments at any time. So that's just because you work in a different group that's only with annuitants, I think.
So this is
Does that make
about
sense?
employees, not retirees. This session.
It's for everyone, but that rule applies to retirees and employees differently because of tax rules.
Okay.
So,
I just
yeah,
want
so
to
that's
make
the
sure.
reason. I understand why you're confused. Yes.
Okay.
It's because of pre-tax premium rules. Okay, so if there are any others, email them to me. I'm happy to address them. So thank you for all your thoughtful questions. I really appreciate it. Okay, so the second thing I'm going to talk about is that we are going to be adding a certain group of TRICARE eligible enrollees to our federal employees dental and vision program starting next plan year. They're going to be able to enroll starting this open season. And even though you all don't necessarily work with military every day, we wanted to let you know because a lot of feds are also military retirees, and you may get questions about it, so we wanted to let you know what was happening. There's a larger group that is going to be eligible for the vision than for the dental program. The idea is that they're actually getting rid of the TRICARE retiree dental program. We're hoping that they'll be very happy in the FEHB program, where there's a broad choice among popular products, including coverage from 10 dental and 4 vision carriers. Okay, so if you do encounter someone who this applies to, the key facts are the TRICARE retiree dental program will end on December 31st, 2018. And current TRDP enrollees must take action to have dental coverage under FEHB to be effective January 1st, 2019. There isn't automatic enrollment. So people who are right now in the TRICARE retiree dental program need to actively enroll in FEHB if they want to maintain dental coverage. Individuals and families may also elect FEHB vision coverage if they are enrolled in a TRICARE health plan. So the vision coverage is more widespread. The dental applies to retirees. Vision applies to active duty family members, and if they're enrolled in a TRICARE health plan. Eligible beneficiaries must make a, oh, I already said that. And that's the open season dates. Okay. So this is sort of the key message. Retired uniformed service members, their families, and active duty family members are eligible. And our wonderful people on the FEHB team and our contractor LTC partners have done a great job on the TRICAREbenefits.com website. There's alerts available, lots of good frequently asked questions, all kinds of information. So I would say the biggest point is if you hear from somebody who's asking about TRICARE retiree dental program ending, visit tricare.benefits.com and sign up for alerts. And once again, they must enroll during the open season to maintain coverage if they're currently in the TRICARE retiree dental program. All right, and I've taken enough of your time. Thank you all. Oh no, there's a question, okay.
Wait a minute, we need to get my team so the people on the webcast.
If you have an employee who's currently active and is transitioning into retirement, how would they go about enrolling in the TRICARE? Right now, they're still currently active. So what would the process be like to get them enrolled under TRICARE? They're currently, they will be suspending their coverage to go into TRICARE once retired.
Right. So just to clarify, so the TRICARE program is run by the Defense Department, and it's for military members. We're welcoming the military members into our federal benefits coverage, but if the person is already a Fed, it shouldn't affect them. They may want to enroll in TRICARE health insurance coverage because sometimes it can be, a better option for them as military members. Does that make sense?
Right, so is he, for example, submitting a 2809 to suspend coverage and is also simultaneously enrolling in the FEHB program during the open season?
The FEHB decision should be separate from the health insurance decision. So, if during open season they decide that this person wants to enroll in FEHB, that's fine. But as a Fed, this new rule or new coverage shouldn't affect them. Does that make sense? I'm looking at my colleagues is that right? Okay. Thank you. Sure. Okay, well now, thank you very much. I appreciate it. And next, Angelo and Alexander are going to talk about the Central Enrollment Database, right?
Good morning, everyone. My name's Angelo Cueto. I've been with the Office of Personnel Management for the past 17 years. I've worked in many different facets, from disputed claims to being in charge of the federal benefits open season to now being the technical manager or one of the technical managers for the CEPD project, and I'm actually working on the database side. My colleague Alexander Deshevsky has actually been with Office of Personnel Management for the past few years as a program analyst. Before his tenure here at OPM, he actually worked at Treasury for about 10 or plus years, working in data analysis and working in payment collection, as well as making payments for the government as well. Now, what we're going to be running you through today is information having to do with the Central Enrollment Portal and Database Initiative Healthcare and Insurance has been working on. And what we'll be talking to you about today, first we'll be talking to you about the current FEHB enrollment process, as well as the FEHB enrollment data process as a whole. We'll be going over some results having to do with our ABO data calls. We'll also be discussing some results from our enrollment transaction analysis, and we'll also be discussing some effects of bad data coming in through the electronic process as well. The next thing we'll be discussing is, or describing, is the future vision of FEHB enrollment. After that, we'll be discussing some of the highlights of our team's initiative to date. And lastly, we'll be discussing what we kind of expect from you guys as the ABOs moving forward. Now, what we're looking at here is the current FEHB enrollment process. As you can see, it's pretty simple. You guys just really start there. I'm not really going to spend too much time on this. This would probably take about 2 or 3 hours just to describe. What I wanted to really discuss was actually the FEHB enrollment data process. Now, as you can see on the screen, there's numerous stakeholders involved, from the ABOs in the bottom left to the shared service centers, that's your Employee Express, that's your MyPay, EBIS, those types of systems, the OPM or the FEHB data hub, as well as the FEHB carriers. Now, what I wanted to bring to your attention next is actually the timing in between these entities, or how long it actually takes for a 2809 enrollment transaction to get from the enrollee over to the hands of the FEHB carriers. Now, on a daily basis, employees either hand deliver a 2809, a paper 2809, or go into a self-service system, Employee Express or MyPay, and input that 2809 information into the system. Sorry, it looks like these guys got a little out of whack. From Wednesday to Friday, the data providers, those are your agencies as well as your self-service centers, they pretty much put those files together for Macon to pick up. Now, on Friday, Macon picks up those files from the data providers on a weekly basis, and over the weekend, they run through their HIPAA compliancy process. So they make the data transactions, or the electronic transaction files, 834, 5010 compliant for the carriers to pick up the following week. Now, from Monday through Wednesday of the following week, the carriers actually pick up those files, and by close of business on Wednesday, a little over 99% of the files have been picked up. So let's put this into perspective a little bit. If you were to hand deliver a 2809 form to your HR office wouldn't transmit that information over to the data hub until later this week. FEHB Data Hub wouldn't pick up that information until Friday, so there's inherently a 5-day gap right there, right? Next week would be the first time that that information would actually be available to the FEHB carrier. Now, by Wednesday, the carrier would have, or excuse me, by the next Wednesday, the carrier would have all the information for that electronic transaction. But if anything is awry, or if anything is wrong with that electronic transaction, that's going to get kicked back to the agency, which is going to cause even more of a delay in that member's enrollment. So as you can see, the current enrollment process isn't as efficient as we'd like it to be, and that's one of the things that we're going to be discussing in the next few slides as well. So over the next few slides, what I'd like to go over is some of our results from our agency benefit officer data calls. Agency benefit officers pretty much told us that their greatest challenges in processing FEHB enrollments was explaining rules and processes to employees. And actually, one thing that I wanted to throw out there was we didn't just canvass a handful of agencies or agency benefit officers. We threw this out to our slew of ABOs. We received information or answer sets from a little over 200 agencies, and this is the information that we've received from those guys. So again, explaining rules and processes to employees was one of their greatest challenges. 39% of the ABOs that responded said that this was an issue. The length of time an electronic enrollment transaction actually took to reach a carrier, just like what we spoke about on the last slide, you can see why that actually happens. And lastly, 67% of the agencies polled said troubleshooting enrollment issues was an issue as well. Now, Alexander is going to be going through some of our enrollment transaction analysis results, and you'll see where the discrepancies or issues lie with the data flowing through the electronic process. Now, what we're also learning from our agency benefit officer data calls is that there's an inconsistency of enrollment processing. We're also seeing that about 64% of ABOs manually transcribe the information that they receive via paper 2809 form into an electronic system. Now, that could lead to discrepancies from the fax form that's sent over to the plan versus the electronic information that's going to follow through the electronic transaction process. Now, we also asked ABOs when they actually requested documentation to determine eligibility for belated enrollment requests. Now, we thought that this would be kind of standard across the board, but we were a little surprised by the results. 30% actually request documentation for all requests, 18% requests only for, I believe, QLEs, and 14% request documentation for extenuating circumstances. Now, in my mind, if you're asking for a belated enrollment request, that is an extenuating circumstance, and it would really seem like you wouldn't have to ask for that documentation. So let's move on. The next slide that we wanted to talk about was actually where agencies are keeping documentation or the support and documentation for, say, QLEs or any of that stuff. Now, 31% of the agencies polled said that they kept their support and documentation in an electronic system, HR line of business, or some type of electronic system. 49%, a staggering 49%, said that they keep a paper file. So, this day and age, I don't know if that's actually acceptable. And 20% said that they're actually going above and beyond. They're actually saving a paper copy somewhere, but also saving an electronic version somewhere as well. Now, this slide's really interesting because it kind of showed us exactly how inefficient our electronic 2809 and 2810 process is currently. And as you can see, 51% of the agencies polled said that they sometimes mail or fax the 2809 forms over to the carriers. 39% said that they always fax or mail over the 2809 forms to the carriers. Now, also, let me put this into perspective for you as well. If you fax over a form today to the carrier, that's going to get into the hands of the carriers today. The carrier is going to then go into their system, hand input the same information from that 2809 into their carrier system. Whatever information you've inputted into your electronic system to transfer that electronic 2809 information to the carrier, if it's not 100% consistent or accurate with the faxed information, that's going to kick up a discrepancy, right? And one of our carriers actually told us that this is one of the biggest issues, is that they get the fax form, then they get the electronic version, and they don't line up. And they have about 60 individuals that are responsible just to handle these types of things. So again, if we can fix just this type of stuff, this will actually save the government as well as the program a lot of money. Now, Agency benefit officers indicated that an online enrollment system would be beneficial for helping with enrollment transactions. Primarily, it would effectively be, it would allow employees to make elections or changes for all QLEs. It'll facilitate the transfer of coverage amongst agencies, and it'll also eliminate the need for faxing forms. Now, Alexander is going to come up here next. He's going to be discussing some results from our electronic enrollment transaction analysis.
Well, first of all, I'd like to talk about why is this important to you as the agency benefit officer. Because the first thing that I'd like to say is that I don't care whether you're Netflix, Amazon, or the local grocer, you need to know who your customer is and what they're doing. The other major reason is that we need to be the facilitator of timely and reliable data. We are finding all sorts of issues about reconciliation issues, having the wrong person enrolled, and having a number of things, or having the wrong agency paying for the right employee. We looked at the second half of last year. So we did 12 months data, and I want to make it clear is that we did this over 2 years. We did from July to December in 2016 and 2017, so we caught 2 open seasons with that data. We also looked at some of the things that we found. We found timeliness issues. We found that basically the data that we were getting, the enrollment data, was getting to the carriers late, and it's, as we talked about, causing confusion, sometimes making it quicker to just fax it. We also found mandatory data issues, and these are issues. We found about 2,000 of these where there's missing critical data like Social Security number, employee name, and payroll office are not getting on there and just getting rejected, so it's not even getting there. We're also finding about a lot of data discrepancy. I'll get into this a little bit later, but sometimes the data is not correct, and oftentimes it's not even close to being correct. And we also found a number of competing information about dependent data, and we'll get into that in a little bit. So the first thing I want to talk about is that, again, we looked first in 2016, 2017, we looked for 6 months of data, and we looked at about 370,000 changes. And again, I want to emphasize something. These are the 2809. These are the employee-initiated changes that were made. This does not include the 95% of our customer population that just passively re-enrolls every year. So again, this is a small subset, and we're seeing some problems in this small subset. I just want to make that clear. These are an analysis that we found late. And what I define by late is that in our contract, we tell the carriers that we're going to give them 14 days to be able to load things. So they have to load stuff on their own system. They need some lead time. They also need to get that insurance card into the hands of the actual customer. So that's why we want to give them this 14 days. Now, we're seeing a significant amount of QLEs and initial enrollments that are late, and we understand that. I mean, you should know when you're about to get married, but sometimes people don't remember to put it in. You certainly don't know when your baby's going to be born, and occasionally you don't even know when you're going to get divorced. It just happens. So we understand that, but it is a significant amount. We have to build that in. But what surprising to us was both years, just in the 6 months, we saw 15,000 open season enrollments that were late and that weren't get there for the 14 days. And as Angelo talked about this in a little bit more detail, we think that this is really just a bottleneck, is that, by the time it gets to you folks, you send it to Macon, and then they process it once a week, and then it's not picked up till Wednesday. So we think that that's part of the problem of what's going on here. Another thing that we're finding is weird things with names. Now, we saw about 700 each year of one-letter first names. So we kind of dug a little bit what's going on here. A lot of them were like first name, middle initial, they go by their middle name and then their last name. So like H. Raymond McMaster would be like an example of that. So this is actually throwing off because we're seeing different ways of names are written on. So it's causing reconciliations and enrollment issues on the back end. We're also finding a weird amount of one-letter last names, and I've never met anybody with a one-letter last name. Maybe some of you have, but but not that many. And we were trying to figure out whether it's like Q from like Star Trek or Q from James Bond. We couldn't really think of a scenario where that would be the case. We're also finding some weird things. And again, I'm going to put this under the, hey, this is interesting. It's not necessarily incorrect. Doesn't mean it's necessarily an improper payment or improper enrollment. But it was a little weird. We weren't expecting to see this number of employees that are receiving Medicare who are under 65. Now, there are cases, certainly, like you could be disabled, you could be coming back to work. So there certainly were cases. We were just surprised it was at the level that we did. But the one thing is, if we're in both years, we saw about over 1,000 each year that we're seeing a Medicare indicators no, but we're seeing a yes for Medicare Part A, B, or D, and that we couldn't explain. We think it's just a problem with the error. But again, this is causing reconciliation issues, is causing primary and secondary issues for the carriers down the road, and we want to reduce that. Next slide. What we're also finding is event codes. We're seeing about like 34,000 a year, between 34 or 40,000 a year that don't have any event codes. And really what event codes is, it's important for us, and it's important for reconciliation for auditing purposes down the road, but that's the reason that this person's enrolling. Whether it's open season, a family member becomes eligible for S-CHIP, so the individual becomes Medicare eligible, or a change in family status, like the birth, adoption, divorce, marriage that we talked about. This is throwing us off, and this is a real critical piece of information. And some of it is, we kind of looked at our own stuff and looked at the instructions we're giving our agencies, and that, in cases that the member does not participate in premium conversion, we're saying that's a non-mandatory field. So that's one of our takeaways, is that, hey, this could be fixed partly with the system, but also has to fix with people. We have to communicate the importance of these codes, for our process, for our system. Also, we were talking about, no problem, buddy, coverage effective date. So we found in 2016, we're seeing records that have coverage effective date in the future. When I say, I'm not talking about 6 months in the future, I'm talking about 1 year in the future. And both years, we actually saw a significant number that were actually made in the past. So like, for example, in 2016, we had one from January 1st, 1976 as a date of action. And in 2017, our earliest was 1971. So we thought about the future. We couldn't think of a scenario where that would be the case. The only one we could think of possibly is that we've got some employees that are time travelers throughout there. And you work in HR, you might have some experience with that, but we couldn't think of a situation. We're also finding, and again, this probably doesn't happen to you and you probably don't see it, but on the back end, a lot of times that when you have got insurance or secondary insurance, neither insurance company carriers really want to pay the claims. So they both kind of point the fingers like, no, you pay it. So we really need to know, who are our customer base that actually has secondary insurance. And again, we saw 102 that said they did not have any insurance, yet they have a name or a number later on in the process. And then we see significantly more say, yeah, I've got insurance, and they don't put down the name or the number. So this is going to cause all sorts of problems in the backyard, in the back, and on, down the road for the carrier, especially when the claims come in. And we saw pretty similar numbers, as you could see, in 2016 and in 2017. We're seeing a consistent issue. Another thing that we were surprised to find is blank agency codes. We're pretty good at being able to determine each enrollment down to a payroll office, but we're seeing about 89,000 a year that don't have an agency code, so we can't tie it back to an individual agency. And this is causing a lot of issues from the carrier's perspective because they don't know who to charge. A lot of times people are moving, a lot of times there's just all these weird things, but basically we really want to get, from reconciliation purposes, we want to get down to that agency level and not just at the large scale like payroll. We're also seeing a lot of, a little bit more than we expect. And again, we're only looking at a subset. We're looking at 5% of the people that actually make a change for the year. But we're finding about like 600 in both years that an individual is listed as an employee and also as a dependent. So we thought there could be scenarios where this could be legitimate. That's not what we were finding. As we dug a little bit deeper in that, We saw like one case where husband is self plus one and the wife is self, and they both had the same plan, everything was the same, but but basically the wife as self only is double paying, and it's costing her $245 a month. It's costing the government $496 a month while this is occurring. Another example that we saw was kind of common is that a mother made an open season transaction, and she had a son who was going to turn 26 in August. So basically, even though they had the same plan, he was also employed by the federal government. Basically, the son, starting in January, took his own self-only. And it ended up costing the son $196 a month. And again, it's costing the government $496 a month when he could have just been on the family plan through July and then in August when he turns 26. And this, again, I think is communication. It's a confusing law, the ACA. This is a new transition. So that's what we're finding. Another thing we're looking at is 2810. And again, 2809 is agency initiated. This is, that's individual initiated. 2810s are agency initiated. And we're seeing some weird things in the data. Like we're seeing records that there's a zip code that does not belong to the right state. We're seeing weird things in the date of death. We saw a couple with both years with 19 as the date of death. I'm not talking about 1900, I'm talking about 19. And we looked as we had no idea what was going on. We also found weird things about the cities. Now, we actually were finding cities that have non-letters, so they've got like numbers and special characters in their name. We Googled this. There's not a single city in the United States of America that has a number or a special character in it. We've got proof. It's not in Google. It doesn't exist.
All right. So the effects that Alexander's data analysis, the issues with the data actually funneling in from the agencies through the Macon Data Hub over to the carriers have numerous effects on the agency, the enrollee, as well as the FEHB program. Most importantly, like we've been talking about, it has some enrollment reconciliation and audit functionality repercussions. What we're also seeing is that, just like what we talked about with our antiquated electronic enrollment process currently, the agencies as well as the carriers have implemented some workarounds, and that's that faxing of the information or faxing of the 2809 forms over to the carriers. I'm not saying that it might have been wrong, but I know you guys were just trying to get the information over to the carrier as quickly as possible to be processed. But in doing so, the types of issues that this could cause is possible dual enrollments, possible delays in member enrollment as well, additional costs to the program as well as the enrollee. The customer experience is definitely inconsistent across agencies and across the government. And lastly, enrollee and family member information discrepancies as well are present. Now again, this is our current FEHB enrollment process, and what we'd like to go to is more of a seamless enrollment experience. Now the seamless enrollment experience would consist of really 4 different areas. The first one being the central portal or the one-stop shop and buy. During open season right now, you go to our OPM website, you go to our plan comparison tool, and you do your shopping, right? But then you have to go to your Employee Express or your self-service system to actually do the buying itself. Now, we'd like to streamline that process where you would go from the plan comparison tool directly into the buying experience as well. This central portal will also be account-based, so your enrollment transaction history is also envisioned to be located within the system as well. Now, the next piece of this central enrollment, I guess you could call it the seamless experience, is the Central Enrollment Support Center. This is going to be inclusive of online and mobile enrollee assistance, and it's also envisioned to include chatbot technology. Now, we're also going to be including premium aggregation, which is going to include a one-to-one accounting or reporting of the enrolled population. And what this means is the FEHB program will finally know exactly who's enrolled in the program, who their covered family members are, how much they've paid, how much they haven't paid. We'll have a complete accounting of our enrollment population as well as their accounting as well. Now, the last piece of this CPD is the database itself. Now, this is going to contain employee eligibility information as well as enrolled family member information as well. The information that we collect via this database, we're going to use to drive program improvements. And this is what our future vision of FEHB enrollment actually looks like. The 4 areas that we just discussed, from the central portal to the database to premium aggregation, can actually be seen in the circle in the middle. What it acts as is a data intake as well as a data provider mechanism to the various stakeholders, from payroll to the FEHB carriers to the FEHB population themselves. As you can see, it's not as complicated as our current FEHB enrollment process, and it's definitely streamlined. Now, what I'd like to go over next is some of our highlights of our efforts to date. Now, the CPD team has established, we have a healthcare and insurance team that's primarily working on the CPD project. We are guided by an ESC, or Executive Steering Committee, who's led by our Deputy Director in Healthcare Insurance, Lori Bodenheimer. And we do have a broad range of representation across OPM, from the CFO's office to the CIO office to retirement representation as well. We're also coordinating and aligning with other federal projects, including the Electronic Digital Record, or EDR, as well as working with our federal benefits open season folks as well. We've developed current state FEHB enrollment process flows, and we've also scoped out a little over 40 IT systems that currently touch the FEHB enrollment process. Now, our team has also iterated on many documents, including defining a business vision and strategy. And as Alexander gave you the results from, we analyzed over 750 FEHB enrollment transactions that came in 2016 as well as 2017. There are plenty more that came in through the FEHB Macon Data Hub, but that was the sample set that we looked at. We've also initiated recently a Macon Data Hub enhancements project. Now, this is huge because this is actually going to affect you guys moving forward once this is implemented. It's a three-pronged approach. The first one being that we're going to implement some new or enhanced validation rules at the FEHB Data Hub level. So guaranteeing that the information that we receive from the agencies or the self-service centers, the data providers themselves, is the accurate and comprehensive data set that we can then funnel over to the carriers. The second piece is actually going to touch on the timing. So just like what we talked about earlier when I showed you the data process and the inherently slow week to a week and a half delay for that electronic enrollment transaction to get from the enrollee to the carrier, we're going to up that weekly transmission from the data providers to the Macon Data Hub to a daily transmittal. The last thing we're going to be working on is we're going to be including some more data elements into the data feed, making it a more comprehensive data set that's going to be received by the FEHB carriers. And this is going to be inclusive of family member information for the specific transaction. Now, the last thing that we have worked on, Eric Kruchnet, who is also a technical manager for CPD, also began the process of estimating financial savings resulting from the CPD. That's what we've been working on so far. Now, what's our ask of you guys, the agency benefit officers? First and foremost, we want you guys to send over clean enrollment data. So please ensure that whatever information you receive, if you receive a paper 2809, please ensure that that information is 100% accurate with information that you're inputting into whatever HR system you're using. The second piece is dependent data field values consistency with relative data fields. So just like Alexander talked about earlier for the Medicare issue, If you say that an enrollee does not have Medicare, they should not be able to check off that they have A, B, and D. If they choose yes, then they should give you the examples of what Medicare coverage they actually have if it is A, B, and D. Right? Complete data set is sent to Macon Data Hub. So again, this is just, again, saying, hey, could you please send over any and all information that you receive, all the information that you receive on the 2809, please enter in comprehensively so the carriers get the complete data set. And the last piece is the quality of the data. Please ensure, again, that the information that you receive via the 2809 is comprehensive and it actually matches the 2809 information. And lastly, please tell us what your pain points are with the electronic process. If there are data points or data elements that are causing issues, or you're seeing certain electronic transactions are being rejected for, one reason or the other, we'd like to know about those as well. And if there's any questions, Alexander and myself can be reached at the email addresses above. And at this time, I think we'd like to open it up for questions.
Okay, got a couple here. Give me a second. Okay, they're asking about the enrollment portal. What is the timeline for this? When is the target to go live? And will it be able to scale up to support the decennial census volume? So whenever.
We're currently working on requirements. We've actually worked with a vendor to discuss our vision, our strategy. We've come up with use cases and all that stuff. We're currently scoping out more requirements, working on more documentation, but we do not have a set timeline on when we plan on implementing at this time.
Okay, and another one, I think you already answered this, but good to go over it again. So what is the proper method for handling SF 2809s? If we process the enrollment into the payroll system, are we supposed to also fax a copy to the FEHB carrier?
The fax 2809, Jay, help me out with this. Fax, what is the rule? Because
I think the issue is exactly what we talked about, is that time lag. And I think that's what we're trying to fix, because right now, you can send a fax basically the speed of light, where this electronic enrollment transaction will take a week. And we know people want to get enrolled, and we know you want to be conscientious to help get people enrolled. But we also want to try to avoid fax unless it's an absolute emergency.
let me say this. Once we have implemented the daily transmission feed, which will be in the near future, faxing of forms, we would like for that process to actually stop.
Okay. How will leave without pay situations be handled in the new centralized system? There are 3 questions here, so that's the first one.
Leave without pay, that's another one of those, I guess, processes that we're working towards as well. Look at it like this. Any electronic enrollment transaction, we're going to have to work on whatever flow that is, whatever work process that is, whatever data elements we're going to flow over from the data provider over to the FEHB carrier. So all those pieces we will touch, but as far as right now, we don't have anything prominent.
Okay, yeah, and the other questions I think are more involved as well. Once the system is active, will there be a requirement for agencies to provide input or input all prior FEHB enrollment information for their employee population?
No, we actually have a couple of ideas on how we can take information from various data sets and be able to marry those things together, marry those data pieces together to come up with our data set.
Okay, and this one I'm sure will go out to a lot of you guys as well. Will the information from the database be accessed by OPM retirement processors as proof of required 5 years for enrollment towards retirement?
That's definitely one of the things that we have been looking into, and yes, the answer is yes, yes, yes.
Okay, and I think I will forward the rest of these to you because I'm weeding through them and, oh, somebody's asking for, didn't hear your response. That was the faxing the 2809.
Faxing of the 2809. Currently, with the current process, I don't know if we can really do anything about that, but like we talked about, once the daily transmission feed is implemented, we would like for that process of faxing and mailing of the 2809 forms to stop. Because the way we look at it is right now, like Jay talked about, right now there's an inherent kind of lag for that information to get over, right? But if there's a daily transmission feed, there should be no need for that fax information or to fax that information. Once you input that information today, that information will be sent over electronically over to the carrier that day as well. Thank you very much. Have a great day, guys.
A question. I just want to make sure I understand.
Sure.
Whenever I certify a 2809, I take it to my processing unit. They enter the data into our system. Then that is forwarded to our payroll, and our payroll is NFC. So does it take 10 days for NFC to transmit that data to the carrier? Is that how that works?
Yeah, pretty much NFC is pretty much like your data provider. So they would pretty much on, say, Wednesday through Friday, they would create that file for Macon to pick up, right, on a weekly basis. Macon would pick up that file on Friday. That information wouldn't be available for carrier pickup until Monday. Just like the example we were talking about, if you put in the request, say, yesterday or today, it wouldn't be available for FEHB carrier pickup until next week. And that is if it's 100% accurate. Yeah. All right, thank you very much.
Hello, everybody. My name is Doris Rippey. I'm the lead HR specialist for leave policy here at OPM. And sitting incognito in the office, in the audience, is my colleague Tanika Green, who is now Tanika Reese. And she and I, if you were at the last conference, we did a breakout session on this subject. So if you were there in the breakout with us, you're going to get a repeat. But otherwise, this is a distillation of 90 minutes in just a few. So we're really happy to have a few minutes with you today, especially as we are facing Hurricane Florence. We're in the crosshairs of Hurricane Florence, which is headed straight at the East Coast, North Carolina, South Carolina, and Virginia. So the ELTP is a program, the Emergency Leave Transfer Program is a program that hadn't historically been used very frequently, but recently it's become much more frequent. And so we are really happy, especially with Florence barreling at us and this being Emergency Preparedness Month, to be able to have a few minutes to talk with you about the Emergency Leave Transfer Program, and specifically about some guidance that we had put out last year on what to do with overlapping ELTPs. So just to tell you a little bit what we want to cover today, we want to do a very quick and dirty overview of the program's authorities and features, and including how responsibilities break down between OPM and between agencies. Then we'll go into a little peek behind the curtain as to what our office does when we know that a disaster is probably going to occur. So that's what Tanika and I are doing right now as we're preparing for Florence, and also as we're looking at the wildfires that are happening in California. So we'll tell you a little bit about how the process, we put the process together to decide whether an ELTP is necessary or not. Then we'll talk a little bit about this new reality and how disasters and emergencies are becoming much more frequent, which will lead into the guidance that we had put out last year to help agencies administer concurrent or overlapping ELTPs. And finally, we're going to point you to some helpful resources that you can use. So let's start by covering the who, what, why, when, where, and hows of the ELTP. It's the purpose of it, and it's the policies and procedures. So as you probably know, in the event of a major disaster or emergency that has been declared by the president, OPM, in consultation with OMB, can establish an emergency leave transfer program. Now, things have changed since 2016. The statute actually says it's the president that tells OPM to establish an ELTP. But in 2016, there was an executive order where the president delegated the authority to OPM. And now we have the authority to establish an ELTP in consultation with OMB. And if we do that, then we have to inform the president that we have established one. And once an ELTP is established, then OPM notifies agencies about it. So the program allows federal employees to donate annual leave to other federal employees who at other federal, either at their own agency or other agencies who have been adversely affected or have a family member who's been adversely affected by a disaster or emergency, so they can have additional time off from work without having to use their paid leave. ELTPs cover employees both at executive and judicial branch agencies. And affected employees don't have to be faced with a medical emergency the way that they do with a voluntary leave transfer program. So it could be a property emergency or a medical emergency. And it's separate from and distinct from either the leave transfer or the leave bank program. So what are the requirements to be a disaster or an emergency? The first bullet and the sub-bullets are actually the definition in bulleted form of what constitutes a disaster or emergency. It has to be a major disaster or emergency. The disaster or emergency has to have been declared by the president, and it has to result in severe adverse effects to a substantial number of federal employees. So what are those substantial effects? That can either be loss of life or property, serious injury, or mental illness as a result of a direct threat to life or health. So many emergencies, as you can see when you look at what the definition is, may never rise to the level of being a disaster or emergency as conceived in the ELTP. And that could be because it's either a localized emergency. So maybe someplace there was a tornado and 5 houses were knocked down, but only one federal employee was affected. Or there could be flooding in an area where there aren't very many federal employees. So neither of those would rise to the level of being a disaster or emergency under the ELTP. Now, it's up to OPM to determine whether a disaster or emergency does meet the criteria, and we'll talk a little bit later about how we do that. So what kind of disasters are we talking about and emergencies? That can either be a natural disaster, hurricanes such as the ones listed here, severe storms, flooding, and tornadoes, which happened in Oklahoma at one point. Fires, we had 2 sets of wildfires in California last year that had ELTPs established, but it could also be an emergency such as a terrorist attack or bombing. So the bombing of the embassies in Kenya and Tanzania, and of course today is September 11th, and we all remember 9/11. So once OPM establishes an ELTP, it's actually the agencies and not OPM that administers it. So depending on where a disaster or emergency has happened, not every agency is going to have affected employees. So it's up to each agency to decide, do they have affected employees? Do they need to institute an ELTP for a specific disaster or emergency that OPM has set an ELTP up for? And if the agency decides that they need one, they establish it and administer it for their agency. So an employee who wishes to donate annual leave to an ELTP submits an application to his or her agency that they want to donate a specific number of hours of annual leave to a specific disaster or emergency. And the employee uses our OPM 1638 form, a request to donate annual leave under the ELTP. So that's important to know, and we'll talk a little bit more about the administration of concurrent ELTPs and how to use that form there. So agency leave banks may also, with the concurrence of the leave bank board, donate annual leave to an ELTP during either within the own agency or during a government-wide transfer of annual leave. So we changed the regulation after Hurricane Katrina because during Katrina, we were contacted by a lot of agencies that had leave banks that said, we have so much leave in our leave bank, we could give you leave today, and it would not affect our leave bank or our employees in the least. And we said, yeah, we'd love to accept that, but the regulations don't allow it. So we changed the regulation after Katrina, and now agency leave banks can donate to an ELTP. So leave banks with balances larger than their employees need may wish to donate to an ELTP because they know that it won't be detrimental to their leave bank or to employees. So not every agency has a leave bank. So let's just very briefly remind you what the program is all about. So agencies have discretionary authority to establish a voluntary leave bank at their agency. So can I see a show of hands of any agency that has a leave bank, that you know has a leave bank? All right. So what agency are you with? Federal Trade Commission? Department of Justice. Okay. So there aren't very many agencies that have leave banks, but they've become more and more popular. More and more recently, we've been contacted by agencies that want to stand up leave banks. And for example, NASA and state in the last few years were some of the latest that stood up leave bank programs for their agencies. So for those of you who aren't familiar with the program, here are just a few major points of it. Similar to the voluntary leave transfer program, it allows employees to assist other employees who have medical emergencies and who have exhausted their own available paid leave. Employees have to donate the amount that they would, the amount of annual leave that they'd accrue in a pay period in order to be a member during an open season, and then they are a leave bank member for that leave year. And all the leave is pooled, and then agencies distribute it to affected employees who put in applications. So agencies aren't required to establish a leave bank, but they can if they want to. And if annual leave is not used by an employee, it's given back to the bank in the same way that it would be given back to a donor under the leave transfer program. So banks are administered by leave bank boards, which have 3 members, one of which has to be from an employee organization. And notice that one of the responsibilities of the leave bank board that's really important is to maintain an adequate balance in the leave bank. And so that's important later on, as I said, later on if an agency would want to donate to if a leave bank would want to donate to an ELTP. As long as they can maintain an adequate balance, they're certainly able to do that. So as I said, donations go into one pot or pool and are commingled and then distributed as employees have need. So let's go back to the ELTP. In the same way that under the voluntary leave bank program, in the ELTP, leave is also commingled. So I'm not donating to Tanika or to Candace or to Mike. I'm donating to a pot, and then the agency will look at all the applications of people who were affected by that disaster or emergency and parcel out the leave according to the employee's needs. So what's really important to know is that it's the agency that does all of this. So anytime we stand up an ELTP, we get flooded with emails about employees that want to donate, but it's actually they need to go and talk to their agency HR office and find out to whom they give the forms to when they want to donate. And they need to find out, of course, if their agency even has affected employees, because not every agency will, as we just discussed. So an agency needs to gather estimates from any affected employees as soon as possible to determine the level of need, because they're going to need to parcel out that donated leave to the employees according to the needs that they have. So if an agency eventually determines that they're not going to have enough annual leave to give to all their employees, so this specifically happened during Katrina because it was a very, very localized emergency. And there were some agencies where the predominant number of employees were right there, and so they just did not have enough annual leave to cover all the employees' needs. So we put out a government-wide solicitation. Now that emergencies are becoming much more frequent, we need to be able to know that agencies have done their utmost to solicit within their own agency before they come and ask for donations from outside of their agency. So agencies, as soon as an ELTP is stood up and they have affected employees, they need to go out there and poll their employees and try to figure out exactly what the level of need is. So if the agency has done multiple solicitations, if they've talked to their leave bank, if they have one, to find out if the leave bank would want to donate and they still have a gap, they can come to OPM, and then we will go out and solicit on their behalf from other agencies. And we'll notify each affected agency then how much annual leave we can give to them. So it is relatively rare. Hurricane Katrina was the first ELTP where we've needed to do that. We have done it a few more times, but we're going to become a lot more stringent about having agencies do multiple solicitations and really beat the bushes to get the donations instead of just relying on us to go out and solicit to other agencies. So, of course, in the same way that we would do this for any individual leave donor under a leave transfer program, when a disaster or emergency terminates, and agencies will look at on an employee-by-employee basis, because some employee might have lost their roof and another employee lost their home. Somebody might be injured and in the hospital. Another person might just have a small injury. So the agency is going to look on a case-by-case basis at every employee. What is the disaster? How are they affected? How much leave do they need? When is the emergency over for them? And then the agency will actually close out for all of its employees an emergency leave transfer program at that agency. So when a disaster or emergency terminates, any unused donated annual leave goes back to the donors or to the leave bank program. And of course, as it is under the VLTP, it's given back proportionally to the donors or the leave bank. So now we're getting into the important stuff for the concurrent leave, emergency leave transfer program. So annual leave donated to an ELTP for a specific disaster or emergency can't just be transferred to another ELTP. But, and that's based on what the statute says. It says that an employee donates a specified number of hours to a specified disaster or emergency. So as much as we would like to take something that was donated for Irma and give it to Hurricane Maria affected people, we can't do that because of the way that the statute is written. However, a donor, him or herself, may redonate annual leave that's been given back to him or her to another emergency. And redonation is really important, specifically in the cases of the multiple or overlapping ELTPs. So how does OPM establish an ELTP, and what is Tanika going to be working on for the next few days as soon as she gets back to the office? Well, when the first thing that happens is the president has to declare that a disaster or an emergency exists. So when we know that a disaster or emergency is possibly developing, we are going to watch closely to see how large it is and where it's heading. So right now we're monitoring Florence, looking at the places that might be affected, so that we're kind of teed up if anything would happen. And we will look and see if there's a disaster declaration, and then for disaster declarations, as I'll show you in the next slide, certain counties are mentioned in the disaster declaration. So we will run FedScope numbers, and the FedScope cube is a multi-dimensional data source that brings together all kinds of key data elements on the federal workforce. And agencies have access to some parts of it. OPM has access to much more of the data. So we can slice and dice the data to look at, in certain counties, how many federal employees are there, what agencies are they employed by. And that's what we'll look at. So this is what a FEMA disaster declaration looks like, and the disaster declaration is actually that DR designation. There are others that FEMA uses, but this is the DR. So it's kind of hard to see, but you can kind of get the idea that when Hurricane Harvey hit, the shaded counties in the lower right were the counties that were mentioned in the disaster declaration. So when we ran numbers, then we looked at what agencies have employees and how many employees are there in these counties that are named in the disaster declaration. And then we went out and polled the agencies, and this is what we would do for any emergency in the affected area, to request their input on how many of your employees who are in these counties are experiencing severe adverse effects, and do you believe that an ELTP is necessary? Because we have to roll that up, present it to the director, and then consult with OMB to determine whether a significant number of employees are adversely affected. And then we'll use that to make a determination as to whether the ELTP should be established. So now we're leading into our guidance for our new reality. So what is that new reality? Well, frankly, disasters and emergencies are becoming a lot more frequent than they ever had in the past. And recently there've been an unprecedented number of emergency leave transfer programs, and they have overlapped, and that never really happened before. So let's look historically at what the ELTP looked like. So these next two slides show all of the ELTPs that have been established since the program existed. And if you might recall, if you're an old Fed like I am, when the Alfred Murrah Federal Building in Oklahoma City was bombed, that was one of the impetuses for creating the ELTP. So it didn't exist before that, and it happened in 95, and the statute creating the ELTP was in June 1997. So you can see that fed directly into it. And then you'll notice that the first two ELTPs likewise were actually terrorist bombings. And it wasn't until 2005 that we had our first natural disaster, Hurricane Katrina. Then there were 4 years between, excuse me. So after Katrina, there were 7 years between the disasters, the natural disasters. So we had Katrina in 2005, and Sandy didn't hit again until 2012. Then, however, we had another one in 2013, and then severe storms and flooding in Louisiana in 2016. So the frequency is really picking up until we get to so then we had one in Louisiana and Hurricane Matthew in 26. So that year we had 2 ELTPs, but take a look last year at 2017. We had Hurricane Harvey in September, Hurricane Irma in September, Hurricane Maria in September. So 3 ELTPs in 1 month. Then the California wildfires in October and the California wildfires in December. So within one leave year, we had 5 emergency leave transfer programs. That hadn't ever happened before. So agencies were contacting us and saying, how do we do this? How do we administer the multiple ELTPs? You know, we have employees affected by 3 out of the 5. What do we do? So we issued a memorandum, which is our BALs, our CPM. The equivalent of our BAL is the CPM, the Compensation Policy Memorandum. And we issued one in 2017, Guidance on Multiple Emergency Leave Transfer Programs on how to administer these multiple ELTPs. So we're going to be going into this in a little bit more detail. So most of the next slides are going to be coming directly from that guidance. And one foundational point of the memo, as I was saying earlier, is that you can't take leave that was donated to one ELTP and give it to employees affected by another because of the way that the statute was written. Therefore, agencies have to track donations by separate emergency leave transfer program, and they can't just pool it all and then distribute it over multiple ones. So what about agencies that are affected by multiple ELTPs? I was looking at a world map yesterday, and I think they spread the world map out on the Weather Channel, and there are like 7 hurricanes kind of brewing right now. So not only Florence, but others. So God forbid we should have a season like last year, but it might be possible. So agencies with more than one ELTP may allow donors to allocate donations to multiple ELTPs on that one form, on the 1638. They just need to really clearly designate to which ELTP they want to donate their leave. So as long as each donor clearly states what his or her intent is, they could use one form but do multiple donations. They could either authorize the donation of a specified number of hours to one ELTP or to several, or they could even allow the agency to allocate where most needed. You know, sometimes when you give to a charity, you can say, I want it to go to this, or you decide where most needed. And so the employee could do that as well. So if there was Hurricane, Maria and Irma Maria and the wildfires, the employee could say, I want to donate 25 hours to Irma Maria and the wildfires, and according to the need, and the agency, you can do that, decide where it needs to go. So if that is the case, then the agency, as they're looking at parceling out the leave, might want to first give all the donations that were clearly indicated. So this is, I just want to give 25 to Maria, one employee might say, or another employee might say, I'll give 25, but you decide between these three emergencies. So the agency might want to give all the ones that were clearly designated and then see what the level of need is, and then designate the rest of the leave that was donated. So if an employee's leave donation has already been taken from their account, they can't redesignate it. But if the leave has not yet been taken from the account, it can be redesignated. And the form that the redesignation would take, so the previous, just to be clear, this what we were talking about is if there already are the multiple emergencies and the employee wants to donate, they can indicate as such. Here, what if there is only one ELTP stood up by the agency in the beginning, but then other ones are established later on? So in that case, the employee could amend their 1638 if the leave hasn't been taken out of their leave account yet. So they could either, however they want to do that within the agency, it's up to the agency. It could be with an email that's attached to the first form, or they could come into HR and just amend the form, however the agency wants to do that. So let's say a leave donor works at an agency where employees were affected by Harvey, Maria, and the wildfires, and they had designated 45 hours to Harvey. They could change that later to allocate 15 to Harvey and Maria, and 15 to the wildfires, or they could do 15 to Harvey, 20 to Maria, 10 to the wildfires, as long as the donation hasn't been taken from their account yet. So what about if an ELTP has been closed out? So I donated to Harvey and that emergency has been closed out. So the agency is getting ready to give my annual leave back to me. If I want, then the agency can ask me and say, listen, we also have employees affected by Maria. Would you like to donate this leave that we would otherwise give you back? Donate it to Maria. So there is a regulation that kind of says the agency that annual leave donated to an ELTP for a specific disaster or emergency can't be transferred to another ELTP. But what that regulation means is that the agency can't do it. But if the employee says, oh, you want to give me this leave back, don't bother to restore it, just give it to this other emergency leave transfer program, they can certainly do that. So agencies with a lot of affected employees may need to go and do multiple solicitations. So they may need to do that. I'm sorry, I just lost my train of thought. Okay, so they may need to do multiple solicitations, and it's interesting that hurricane season often overlaps with the end of the leave year and the time when people need to allocate their use or lose, decide if they're going to use it or whatever. So if an agency usually puts out a use or lose memo, and they should think about including information if they have an ELTP open, including information about that. Hey, we currently have an ELTP. If you have use or lose leave, remember to schedule it, but if you want to donate it, you can do that as well, and that's a handy way to kind of kill two birds with one stone. And then the information to employees can be folded in there about if we have multiple ELTPs, here's how you could designate if you want to donate to more than one. So generally, there's a limit on how much leave employees can donate. It's generally 104 hours of annual leave in a leave year, but agencies can establish written criteria to overcome that limit, to waive that limitation. So agencies that think that they might have a problem soliciting all the donated leave that they may need could consider such a waiver. The other thing to consider is agencies might want to do new solicitations in the new leave year because employees might know at the beginning of the new leave year how much leave they have, and if they don't want to waive that limitation of 104 hours, they can always have employees donate up to 104 in the new leave year as well. So for the wildfires that happened in December, they were, of course, still going on in January. The effects were still going on in January. So agencies should really gather timely estimates on how much leave they might need and help us out and help other agencies out. Because if they're going to have a need, we would like to know that timely so we can put out an interagency request, especially if it's near the end of a leave year, so that agencies without affected employees can include that information in their use-or-lose memos to their employees. Now, of course, we still want agencies to beat the bushes to get as much donated leave as possible through multiple solicitations, through talking to their agency leave banks, and etc. But if the need is there, then we'll solicit from other agencies. Leave banks can also kind of come to the rescue in a situation like this. So if, as I said, with the concurrence of the Leave Bank Board, they can decide to donate to an ELTP. So agencies that have leave banks may already want to key up that idea with their Leave Bank Board while hurricane season is going on and fire season is going on, to have that conversation beforehand, to ask if agency leave banks have a healthy balance, if it would be something that they could consider, if the agency would have affected employees, would they donate to an ELTP? Now, there aren't, the good news is there aren't any regulatory limits on how much an agency leave bank can donate to an ELTP. So there are limits on the individual employee, but not on the leave bank. So if a leave bank has a really healthy balance, they can donate as much as they would want, and there's no limitation on the number of times. So the leave bank could provide a really good kind of safety net for those agencies that have it. If agencies have not yet been able to get a solicitation out to their employees, they could ask for the leave bank for some leave to tide them over, and then maybe ask them later on to help cover any need that was unmet within the agency. So what about agencies without affected employees? There's a lot that they can still do. So in preparation for a possible government-wide solicitation, they should also talk with their leave banks and find out, are they willing and able to contribute? How about having a draft solicitation memo already ready to go? How about keeping a record of employees who've come into the HR and said, hey, I really want to donate? Well, if later on, the employee might not know if there are any affected employees in that agency, so they've indicated their willingness to donate 40 hours. Well, keep track of that, because if there is a government-wide solicitation that's necessary later, the agency can go right back to that employee and say, hey, you said you were interested in donating 40 hours. We don't have anybody affected at DOJ, but NASA has people affected. Would you be willing to donate there? So what can you as a benefits officer do? And there's a lot that you can do to help us out. We'd really like to request that you become familiar with the Emergency Leave Transfer Program statute, the regulations, and the guidance that we put out there. You can also verify that your agency has stood up their policies and procedures for the ELTP. The smaller the agency, the less likely that they've actually created their policies and procedures, even though the regulations require that the agencies do that. Some agencies we know have not yet. So if you, especially if you work in a small agency, but every one of you can go back and make sure that your agency has their policies and procedures in place, because once a hurricane or a disaster or a bombing happens, it's a little late in the day to stand up a new program and get clearance for it. So if you don't have your policies, bring that to the attention of your agency management so they can put them in place. So if those policies do exist, has the agency actually looked at that guidance from last year and incorporated that into their policies and procedures? Do you know who the point of contact is at headquarters in case an ELTP would hit? Do you know who the point of contact is in your portion of the organization? And if you do have your policies and procedures, who is it that's going to poll employees to find out if there are severely adversely affected employees and roll up those numbers? Who is it at headquarters? Who is it in the components? Do you have a leave bank program? Has anybody talked with the leave bank program to see if they might be interested in donating if the need occurs? Does the leave bank even know that they can donate? And who's going to be the person who contacts the leave bank board about that? You can also go back to your agency and suggest that a leave bank be set up if one doesn't exist already. So here are some resources that you can refer to about the emergency leave transfer program. Our fact sheets, if you're not familiar with our fact sheets, they're really, really helpful because we write them in plain English, and they're supposed to be an overview both to HR specialists to kind of provide you the quick and dirty, but also to supervisors and also to employees. So we write it in plain English, the main points of whatever program. At the very bottom, we always have the statute, the regulation, and any other guidance that's important for you to know. So you can also, oops, what am I doing? You can also find the ELTP regulations at the next bullet, the delegation of function if you're a super wonk and you want to read it, although that's not really that important to know, you just need to know that it exists. And especially that Chico memo on multiple ELTPs. And more generally, we have the leave administration page. That's where you can sign up, the second bullet, for our listserv. If you're not already on our listserv, anytime we put out a CPM or other guidance, you can find it there. If you sign up, we'll email it to you. And our fact sheets on leave programs, and then our general CPM listing, which is, as I said, the equivalent of the BAL. So that's who I am, in case you want to remember, and I'd be happy to take any questions if people have them.
We've got one online here.
Yes.
Actually two. One just came through. Has an ELTP been established for Hawaii due to the volcano and the recent hurricanes?
Okay, so there has not been an ELTP stood up for Hawaii because, specifically, there were not enough federal employees who had who experienced severe adverse effects because of that. And right now, Florence is the first hurricane of the season. So we're looking at the wildfires in California and polling agencies about that already. They need to send us their numbers by Thursday. And then I'm sure there are a lot of employees in the Carolinas and Virginia, so we'll probably do a solicitation to find out how many are affected by Florence.
Okay. And then this one, when an employee has mandatory evacuation from his home, but his office is not closed, would he get admin leave as well as applying for ELTP?
Okay, so you might know that we recently published our weather and safety leave regulations, and the weather and safety leave regulations, I'm trying to find it. Yeah, we published the finals in April 10th, 2018. So weather and safety leave regs say that an agency may provide weather and safety leave to employees who are prevented from traveling safely to or performing work at an approved location due to an act of God, a terrorist attack, or another condition that prevents them from safely traveling to or performing work at a specific location. So the question was, if the
mandatory evacuation from his home, but his office is not closed, would he get admin leave as well as applying for ELTP?
Okay, so first the agency would want to look at whether he's going to be provided, whether he's going to be provided evacuation pay, where he's evacuated to, is he telework eligible and ready? So if the employee is able to telework from somewhere, they might not get weather and safety leave. They might not get the excused absence. So that is one of the caveats of weather and safety leave, the regulations provided. This is my quick and dirty cheat sheet on weather and safety leave regs, because I didn't write them. So if they're in a telework program, they generally are not going to be provided with admin leave under weather and safety leave if they're able to perform work either at their home or an approved location.
Okay.
Any other questions? Great, thank you.
All right, so that will close this Benefits Officers meeting, excuse me. Thank you all so very much for coming out. Remember, hopefully within the next week or two, information will be coming out about the Fall Festival. If you're interested in attending, like stated, it'll be on the West Coast, November 27th through the 29th. I stated earlier about our FERCA training, October 16th and 17th in Denver. So additional information will be coming out about that as well. So again, thank you for coming. We appreciate, and we'll see you next time.